Hello, a very warm welcome to the first ever edition of HealthTech for Patients. Thank you for joining us. We are delighted to see that over 200 people from right across Europe are with us today. My name is Alison Monroe, and I am delighted, and it is a great pleasure to host this first and hybrid event. Encompassing the wide and complex world of patient health data, we will discover the role of patients at the center of health innovation today for the enhanced healthcare of tomorrow. Through our exciting exchanges with the whole European ecosystem, we will learn how, collectively, we have together everything it takes: the power, the know-how, the commitment, and the energy to shape better quality of life and improved care for millions of citizens across Europe and around the world. We have a very exciting and enlightening program this afternoon. And we are most fortunate to be joined by some prestigious and talented people, distinguished from right across Europe. As you can see on the screen, this afternoon is organized around two vibrant sessions. First, a roundtable discussion with engaging conversations. Second, followed by a series of powerful presentations and lively discussions with our experts. And your voice counts. We are keen to know what you think and how to hear your opinion and to understand and answer your questions, a selection of which will be discussed by our distinguished panel of speakers. You can join the debate using #HTFP, and you can share your experience in the chat. So please remember to join in and to start the conversation today. We will be taking 2 short breaks during the afternoon. And now, to open our event, it is my great honor and a pleasure to introduce the driving force behind HealthTech for Patients, the president of the endowment fund HealthTech for Care, Marie-Yvonne Jans. And she will be joined remotely by a leading figure in regulatory affairs and VP in regulatory affairs at LallianSe, Pascale Maisonneuve. And they will also be joined from Brussels by the head of unit for the European reference networks and digital health at the European Commission, Joanna Maria Gligor. Marie-Yvonne, over to you.
Thank you very much, and good afternoon, ladies and gentlemen. So it's really a great honor for me to welcome you to Paris virtually for this first edition of European HealthTech Innovation Day for Patients. As you know, healthcare access and treatment for every patient is a global priority. During this last year, COVID pandemic has highlighted the needs of collaboration between all actors of HealthTech ecosystem. And and the power of health data. Indeed, a better use of health data could increase benefits and including faster development of solutions for patients. Europe will play a major role in this transformation. In this context, the goal of HealthTech for Care is to inform the global ecosystem regarding this subject. The priority is to put the patient back at the center of initiatives. I would like to thank the speaker. They will share with us the key factor for enlarging this ecosystem and to progress the science. I would like also thank our partners and France Biotech, the founder of HealthTech for Care, for their support. Before to have the pleasure of handing you over to Pascale Maisonneuve, I would like to say that we have the great honor to welcome Johanna Maria Glingor to tell us more of initiative currently developed by the European Commission. So now, I hope you will have a very nice event. Pascale Maisonneuve.
It's okay? Do you hear me? Okay.
Yes.
So, I'm very pleased to be here with you today. I want to explain you that LallianSe is a life sciences integrator for the fast scaling of health solutions. We are located at the heart of Paris, at the Pitié-Salpêtrière Hospital, and soon at the Bichat Hospital. LallianSe, we provide 3 complementary offers. That is to say, setting up and steering operating partners to support companies' growth and ambition, as well as hospital emerge co-workings and selected events for the life sciences community in France. We support projects or companies with a deep understanding of market needs and trends as we are emerge in hospital settings. With tailored senior experts, we have a network of about 25 experts and operating partner teams to ensure appropriate development paths and with appropriate product road mapping following our equation for success. That means, for us, success in innovation is equal suitable products and market needs and an outstanding team. Our philosophy is to assist in formulating the adequate question, in the setting up of an efficient equity story and steering operation in an agile, flexible manner with high quality standards. Today, we have supported more than 16 companies or leading institutions in a wide range of leadership and healthcare products, such as regulatory and clinical affairs, as well as investor relations, corporate strategy, sales and marketing, and last but not least, general management. Take-home message: we don't consult, we act. We build trustworthy relationships to match management's ambition over time, and we are not standard, we are tailored and haute couture. So it is because we think that the patient has a very important place in innovation that LallianSe is immersed in the heart of the hospital world. This event today matches our shared values by placing patients at the center of innovation. And last, finally, is very proud to open the session by emphasizing the role of patient association in healthcare innovation. Thank you.
I believe we're now going to join Iona Maria Gligor at the European Commission on remote in Brussels.
Thank you very much for this opportunity. I hope you can see my screen. I will have a joint presentation together with my colleague. Apparently, my computer has some issues today. I will do a joint presentation together with my colleague Ander, with whom we are working on the European Health Data Space, and I will try to provide an overview of the main areas of work for this initiative. Speaking basically about the European Health Data Space, the state of play of consultation and the preparation, but also giving more details about the different initiatives and about the next steps. Some of you may have already been familiar with the Data Governance Act, which has been presented by the Commission few months ago, and which sets out the general framework.
Sorry, Jana, to interrupt. I don't know if you're already sharing the slides or
you don't see it.
No, we don't see them.
Sorry. Yes, I'm sharing the slides, but apparently, as I said, my computer is a bit on strike today. Okay, do you see it now?
It's okay.
Perfect. Okay, thanks. So I was speaking about the Data Governance Act and the framework for the European Health Data Space, which basically Data Governance Act provides access to data for all the sectors. And the European Health Data Space aims at supporting being a lex specialis to this and also to other initiatives, and I will come back to this, supporting the health data exchanges for healthcare provision research policy making, fostering a single market for digital health services and products, and deployment of and development of digital intensive and data intensive digital health services and products, including AI in health. With several steps already been taken for the inception impact assessment, which is already available under heavier state. What are the main issues that the Commission has identified in terms of challenges related to the access to data for healthcare and use of this data? Main issues are related to the insufficient health data access and exchange, and also the limited capacity for the people to have to control and to access the health data for this aspect. So what we are seeing, for instance, is that the same tests have to be repeated over and over again between different healthcare professionals, with important costs for the patients and for the society as a whole. What we are also seeing, and I will go to the third column that you see here, is a limited use of digital health services and products, for instance, telehealth and mHealth. They are provided in some cases within countries, but there are limitations across countries. There is also a low reuse of health data for research and policy making, and fragmented infrastructure for such reuse, and also difficult access to health data for AI development and problems related to the development and deployment of the artificial intelligence. I don't know, Ander, if you would like to complement.
No, not much to add. Perhaps just to stress that the first two columns that you see there are essentially linked to the different uses of health data, or first of all, the use of health data for the provision of healthcare, and then the second related to what we call secondary uses of health data or secondary purposes, essentially the further reuse of that data. And essentially there, as Jana was mentioning, the main issue is with the exchange, with the difficulty of exchanging this data across borders. So in a cross-border setting, the provision of healthcare is quite complicated, and the exchange of health data as well. And then also when we go to the more further reuse area for research, policy making, regulatory activities, that is also increased, let's say, in complexity.
So we are not building from the ground. We are building this initiative based on the cross-border healthcare directive that we are evaluating, and we are aiming to take this further on the Data Governance Act and on the AI framework recently presented by the Commission, and on the GDPR. And we are aiming to take this initiative a little bit further. Now, as I said, we have also launched the work for the public consultation with basically work on the legal proposal structured and trying to get the opinion of the public on governance mechanisms, on the content of rules for the access to data, how to facilitate health data from private and public stakeholders, and also the governance at EU level. I don't know, Ander, if you want to provide additional details.
No, not much to add. Again, this is essentially the summary of the, well, not the summary, but some of the options that you can find in the open public consultation. And we encourage you to participate in that public consultation because it's essentially a very important source of input for us, and especially when it comes from citizens and specific actors in the area of healthcare. That's very useful for us.
And overall, basically, in addition to the legal proposal that we have provided some information already, we are also working on soft measures and also more infrastructure measures. So among the work which is ongoing on data quality, making data findable, accessible, interoperable, and reusable, there is also work related to the sharing of health data and accessing of health data for the secondary purposes for research and policy making, and also capacity building for trainings, cross-border cooperation, best practices, etc. So on the, you see there at the beginning of the slide, the primary use of health data. So we already have a body, eHealth Network, which is working quite intensely on such data exchange, and I will come back to this a little bit later. And also on the secondary use of health data, a joint action that had started and is supposed to provide contributions that we will take into account in the context of the better regulation and impact assessment for the legal proposal. Now, I was mentioning exchange of data for provision of the healthcare. So we are speaking about patient summaries, any prescriptions. So what we are talking about is a patient that travels from his country or her country of origin to another country, goes to the doctor, emergency or else. For the time being, it's emergency, but it's supposed to be extended also to unplanned and planned care settings. And the healthcare professionals would like to know more about the medical history of the patient, allergies, medication, implants, surgeries, etc. So This kind of data can be transmitted through an infrastructure which is called My Health at EU to the country of the doctor in the language of the healthcare professional. For the time being, we have 7 member states which are doing such exchanges, and this year we hope to have 8 more member states. So to reach this year, 15 member states who can exchange this type of data. And we are also aiming to add images, lab results, and discharge letters, and also to allow the patients to have access to their own health data. There is also the prescription and patient summary, e-prescriptions, and here we are especially speaking about 2 countries which are very active, Estonia and Finland. And what we are seeing in general is that the moment that we are having basically more countries which are neighbors participating in exchanges, these exchanges go up quite quickly. So between Finland and Estonia, despite COVID, there were around 20,000 e-prescriptions dispensed between the patients that asked for an e-prescription in the other country. I don't know if you want to say some words about the secondaries of health data, Ander.
I think it's important to explain to the viewers that My Health at EU is essentially a very good example of what the eHealth network framework has produced in the last few years. A very good example of what can be done at EU level with the cross-border exchange of health data and how it directly impacts the lives of patients, especially those living in cross-border or in a border region. But then with the European health data space, the scope is also enlarged. And here the idea is to move from only operating or mainly operating in the primary use of health data region and go into the region of secondary use of health data. And in that, it's not only the legal proposal that we are preparing, but we're also working on a pilot for the European health data space infrastructure, specifically looking into the reuse of health data. And there are 3 main stakeholders. One is researchers who can develop new technologies for health. There are also regulators who can also help in the area of pharma, for example, or medical devices, and streamline the processes for example, the approval of new technologies. And there we have the good example of the AI framework and how this health data could help in that area. Then there is also the case of policymakers. And essentially, the pilot aims to bring these stakeholders or aims to demonstrate the feasibility of bringing different sources of health data, federating them at EU level, and see how they can serve the purposes of these different stakeholders. And this is, of course, pioneering work for the later implementation of the European health data space in the coming years. As you see on the screen, there are different stakeholders involved now: data permit authorities, data sharing infrastructures, and regulatory and public health bodies. We're now at the design phase, so there's quite intense work going on our side, and the timeline is essentially to start implementation by the end of this year. So it's essentially, as you see, this is a different strand of work, but it's very tightly coupled with the legal proposal, because of course it interplays with the work that Jona was mentioning on the impact assessment, for example. What we test on one side is also relevant for the other side. Yeah, that's all for this slide.
Thank you very much. So now in terms of funding, I think it's worth mentioning that we have 2 sources of funding. One which supports the investment at national level, which comes, for instance, from the national funds, from Recovery and Resilience Facility, European Regional Development Fund, etc. And also funds who support the interconnection between national initiatives, such as EU for Health and also Digital Europe Program, etc. We would like again to call for the member states and for the stakeholders to make a very good use of the funding at national level, RRF, ERDF, InvestEU, but also to apply in the context of the EU for Health for the funds which support these digital infrastructures, be it EU for Health, the sharing of patient data, or the reuse of health data for research, policymaking, etc. Now, in terms of the next steps, we are aiming at legislative proposal in the first part of 2022. The cooperation with the member states is also ongoing in the context of the joint action or in the context of the e-health network, and we are also working on the preparations of the pilot project. I don't know, Ander, if you would like to add additional elements.
No, not much to add, just to say that indeed there's quite a lot of work going in different work strands, and of course we're doing quite a lot of work in consulting different stakeholders, and it's quite important for us also to receive your feedback. I mean, the feedback of the viewers and of the community in this forum to also prepare better for the European Health Data Space and to prepare better the legal proposal. So we very much look forward for your input, and as I was mentioning, I can put the link in the chat. The Have Your Say consultation is quite an important element for us. Thank you.
Okay, so basically these are the points on our side. Thank you very much for this opportunity.
Thank you very much, Pascale, Marivonne, and Joanna, and Anders, for our very interesting opening to this afternoon's edition. And if you have any questions that you would like to continue to ask Joanna, you can continue to do so in the chat at Anda Elustando Yoregi. I hope that's right. And we are now going to take a short 3-minute break. Coming up afterwards, our first roundtable looking into how health data meet patients' needs. So let's stay tuned, and we'll see you coming up right after the break.